Do you want to do more dentistry, better dentistry, but don't have the time to take off from your office? Travel is too expensive, and wish that you could learn how to do high-level restorative from anywhere on earth? Well, my good friend, Dr. Lincoln Harris, founder of Ripe, is here to share with you how he has created a program to do just that. Link, you've been on our show before, but just for someone who's tuning in for the first time, our audience grows by 1,000 a month. Just share with our audience a little bit about yourself, where you're sitting on earth, what you do in dentistry, and what you strive to help others do.
I'm a dentist in Australia, and actually live right next to the beach, so where the Great Barrier Reef starts, if you kind of know where that is. I'm one of the founders of Ripe Global, and our mission is really to help people get better access to dentistry. So what we found is that better access to education, and what we found was that there's a lot of people who go to a lot of courses, but actually there's an even bigger proportion of dentists who don't go to courses for a whole range of reasons. It could be their office is new and they don't want to shut it. It could be they've got little kids. It could be, sometimes it's because they're in a country that they can't get a visa. And so Ripe Global is built to help support dentists 24/7, give them access to the very best education, and develop, cutting edge technology that allows us to deliver that anywhere where there's an internet.
That's truly awesome. I want to break down this program, and you've delivered awesome value to our dental Nachos in the past. Your goal is to help dentists basically do what? Through this program, we'll go into the details in a second, but the mission of the learning, how would you describe it? What are they going to learn during this program?
I mean, actually, the more important thing is not the clinical bit. It's actually, the head. We want them to be confident and competent with all aspects of restorative dentistry. So that is like for the Fellowship of Restorative Dentistry, that's what we want to achieve. Now, how do you get there? I mean, the end result of that, of course, is that you should be able to do a full mouth rehabilitation. But how do you get, you can't go straight from zero to full mouth rehab. That's just unrealistic. And so the logical progression, and this is how we teach, is let's start with quadrant dentistry. Let's start with being able to do a whole quadrant of crowns, or crowns and composites as necessary, or onlays if necessary. And so we start with quadrant dentistry, then we take people into aesthetic dentistry. Most people graduate and actually don't know what a tooth looks like. I didn't. And so, I wouldn't have known a line angle if it ran over me in a truck. And so then we teach them aesthetics, what makes teeth look good and how do you make it look good in both composite and ceramics. And then we go into veneers. Most people have graduated, they've never really seen a veneer. So we teach them how to do veneers so that they're beautiful. And then we go into full mouth rehab, because now you've got the building blocks of back teeth, front teeth, veneers, ceramics. You can now do a full mouth rehab. And unlike almost all education, we actually also support people through their first cases. So we actually have a whole program on, okay, you've learned how to do it. Now let's apply.
See, I think that's what's so important, Link. We've become friends, and I would love to meet you in person a few years ago. You're coming back, and I've been to courses where I say, man, I wish I could ask that instructor a quick question when I was back in the operatory because this didn't go well. It sounds like you have this consistency model where it's a 2-year program, and your dentists that are students, but they're practicing dentists, they have access to in your team. How do they get this access to you guys?
Yeah, so we've built a platform. We've invested a huge amount into this platform so that the students can interact with each other. It's not Facebook, because the problem with Facebook is all controlled by an algorithm. And so if you're doing something on Facebook, who knows who sees what? So we've built our own platform. The students can talk to each other. They can actually access educators pretty much 24/7, because we have about 40 educators in about 25 countries. And so there's always someone online. And then all the students themselves form a little class. And so they're able to support each other. And so that gives this concept of continuous improvement, rather than trying to, get one massive chunk of education and swallow it all at once.
Yeah, that's it. You gave a good example in a second, but I want to just pause. My grandmother did say I was the most interesting person in the world, Link, but just in case people stop watching at this time, I want to share that we have an awesome code through Dental Nachos, right? Nachos. You can reach out to the Nacho team at salsadentalnachos.com to connect with Link. But what is the best website for people to go to? We're going to keep talking, but I just like to intersperse this here. If they were going to go to a site, what would be the best one for them to go to learn more about it, Link?
I mean, if they want to see our website, they can go to ripeglobal.com. We have a whole range of things there. There's obviously membership stuff, but we're talking particularly about the Fellowship of Restorative Dentistry, which is our big part of education at the moment. And I know that you like deals. Okay,
Yeah.
I see all the time you like deals for your dentist. So I've got a deal for your dentist.
I appreciate it.
And so if people join the Fellowship of Restorative Dentistry between now and the 12th of, I think it's the 12th of August, they get 10% off the program, so it's like $2,500, and they also get 6 months free premium membership on our
Just for knowing me, everyone, you can save $2,500 on this amazing experience, and you can also reach out to us and we'll share with you how to connect with Link. But I want to dig more into the details here, Link, because our dental people, we like details. So if someone would be watching thinking like, this sounds great, but how am I going to learn to do this, on my own time? So just break down the learning process. Are there things they're going to do in their office? What do they need to be able to participate in this Fellowship of Restorative Dentistry, which is a 2-year program? It's going to take you from quadrant dentistry, veneers, full mouth rehab, but what do they need to buy or get in their office to do this?
The one thing they do need, which is included in the course, is that we will ship them the simulation kit. So if you want to think of it like learning the piano, imagine you learn the piano, but you can only practice when you go to piano lab. You would never learn anything. And it's like this with dentistry. Okay, we're going to teach you to do something, but you can only use the mannequin while you're at the teaching facility, and you can't use it at home. That's just kind of silly. Like you can't practice. So we ship you your own mannequin as part of our simulation kit. We don't actually insist that you change any materials. We don't want you to go and change all your composites and all your burrs to the ones we use. We are trying to teach you skill. And if you have skill, you can use just about any diamond burr and any composite resin and any, impression material. So as far as changing everything, we don't want to do that. We don't have suggested materials. If the material you're using just doesn't work, then yes, we will suggest something.
Awesome.
But we don't want people to go and change, because if you're an associate, you can't anyway. So that's just silly.
Yeah. And what I think
they need internet, electricity, and a dental office. If they don't have a dental office, as in if their boss won't even let them use it, which I know it sounds crazy, but there are bosses like that. We even have a second simulation kit, which includes all the stuff so that you can practice your procedures at home on your kitchen table.
Oh, that is truly amazing. So you can do this, in your dental office or at home. But what I want to share is someone who's taken CE and taught CE. It's so much, when you learn how to cook in your own kitchen, you can translate that later. So my thought process with this is, you've gotten students that say learning in the comfort of their own operatory, not having weird dentists look over their shoulder, look at them, is just something that makes them more comfortable in developing those new skills. Am I thinking on the right track with that?
Absolutely. I mean, we're all about implementation. So the vast majority of education is, if you want to look at the biggest costs of education, one is closing your office. So that's by far the biggest cost of any course, is actually shutting your office. And then, travel and hotels and so on. The second one is the course itself. But the third biggest cost of education is education that never gets used.
Yeah.
It's like a waste. And so we're all about having the maximum impact on your career in the least amount of time and cost. And so how do you do that? First of all, we don't run hands-on courses, we run simulations. So who here actually stops for morning tea in a normal dental day? No one.
Right.
Like no one. So when we're teaching people, say, how to do crown preps, we don't stop for morning tea. In fact, we hardly stop at all. We go 7 hours, maybe with a 20-minute lunch break, because that's what real dentistry is like. Yeah. And if you want to have the endurance to be able to do big quadrants and stuff and go all day, you need to practice that.
Yes.
So first of all, we do realistic exercises. So, we do 17 crown preps in our crown prep day, because we want people to develop skill, not just understand how to do it. Like doing one crown prep with lectures in a day is just silly. Secondly, when you use your own handpiece and your own chair and your own triple syringe and your own, sometimes the people get their dental assistants to come and help. Yeah. Then you can directly implement that to the patient the next day, because it's the same stuff.
Yeah, I can see that.
And you're using your own composite resin. And then you can actually find out, if I can do this with the composite I already have, or composite, then why not? And then, if you can't, sure, we'll tell you which one to change to. But
I love that. I mean, this is what's needed. You know, we'll just spend a few more minutes chatting. And I know we've talked about this, and I won't make it a knockdown dental school thing, but you shared with me a couple months ago, it's not just US dental schools, it's dental students all over the world. What is happening to their experience in education? And whether you graduated 3 years ago, you don't just get better by magic, by not learning. What is happening with the dental school process not delivering enough experience to the students?
I think that, I mean, it's easy for us to pick on dental schools, but I don't know that either you or I would like to actually run one.
I do not want to run one.
I think it's a very difficult task. I think what is happening is this: the knowledge in the world is increasing massively. And so dental schools have to instill this base knowledge into students. And as that knowledge increases and increases, the amount of actual physical skill building that they can do. Because once dentistry was an apprenticeship.
Yeah.
So there was almost no knowledge and 100% skills. And we don't want that. And so what's happened is that their ability to build the skill is not there. And so and I'm not going to sit here and criticize dental schools, because I'm imagining that if I had one, I probably couldn't get it. The biggest issue is that dentistry is actually a surgical specialty, and most surgical specialists are trained in hospitals, and they do thousands of repetitions before they graduate. And when they do graduate, they graduate into this big network of people, of nurses and therapists and physicians and specialists who stop them from causing harm particularly in their first few months. This is well known. But we graduate into a tiny little hospital with one other person who's too busy to help us. Yeah. And we've got no one around us. And we haven't done thousands of repetitions because we're a specialist, but we're not trained.
Yeah.
So it's not really a dental school problem. It's just a problem that.
Yeah. I mean, and also, I've hired multiple new dentists after their residency year. And what's poignant, and I think is many times the procedures they do practice in dental school are just not relevant to our private practice world. So unfortunately, when we're looking to pass them the ball, I want to play basketball for my career. We're looking to pass them the ball. They have not learned to do the things that are relevant. But it sounds like in this course, real world relevancy is the name of the game. From back teeth dentistry to veneers to full mouth rehabs, it seems like you guys deliver this. Anything I missed, Link, that you want to share with my audience before we wrap up?
Look, I just say, first of all, obviously, it can be confronting to go, how can I learn from Australians? What do they know about dentistry in the United States? We're all very special. We have insurance. You don't know the rules. And actually, our single biggest market outside of Australia is the United States. We have a ton of students there, and we've got many that have been to other, big brand courses. And they just say that the value of this is just massively higher than anything they've ever done. And so, if people are interested in having a big party, then probably I can't help them. If they're interested in the most impactful improvement in their skills, in the size of their cases, in being booked out longer because they have the ability and the confidence to do things, and they want to do it at the lowest cost possible and immediately implement, then we're here for you.
Awesome. I love that, Link. You're great friends with Artie, who I'm great friends with. You bring so much awesomeness to this dental space. Thank you for that. Please check out Ripe Global. We're going to put in the comments. You can reach out to me directly to find out how you can be part of this next course. Get a discount, which is what you love. Dentists love deals. Save 10% by reaching out to us at dentalnachos.com. Thanks so much for being here, Link.
Thanks for having me, Paul.